Today, we're going to talk about autism, a learning experience in which millions of people, in one way or another, are. If you like the content on this channel, please like and subscribe. You'll help us create more videos. We will start with a beautiful story to open our
Today, I
heart.
want to share a very special story with you, a story from my perspective, from my blue eyes, that see the world in a unique and extraordinary way. My name is Lucas, and I am what you call a person with autism. But you know what? It makes me smile when I hear that word because to me, you're the ones who are different. Let me explain why. I see how they live in a world full of unnecessary noise, of words that say one thing but mean another. Why do they say nice to see you when they're really just thinking about getting home? Why do they hug each other when they'd rather maintain their personal space? It's fascinating to watch. In my world, everything is clearer, more honest. When I like something, I say it. When something bothers me, I also express it, without masks, without social filters. And yes, maybe it takes me longer to process some things, but that's because my mind is like a supercomputer that analyzes every detail, every nuance, every possibility. I have a special gift for math. While my classmates struggle with basic problems, I can see patterns and solutions like melodies floating in the air. My teacher says I'm gifted, but I just see the world as it is, full of numbers and perfect sequences. I'm sometimes asked why I don't maintain eye contact. The truth is, when I look into someone's eyes, I see so much, I feel so much, it can be overwhelming. It's like trying to listen to 1,000 conversations at the same time. I prefer to focus on one thing at a time, do it well, understand it completely. Do you know what the most curious thing is? You worry so much about fitting in, about following unwritten social rules, about doing what is expected. Meanwhile, I am free. Free to be exactly who I am, without pretensions, without social masks. My mother always says that I have a special way of seeing beauty in the simplest things. I can spend hours watching the light pass through the leaves of the trees, creating unique and unrepeatable patterns. I can remember every detail of a specific moment, like a perfect photograph in my mind. Sometimes other kids ask me why I get so excited about specific topics. But how can you not get excited when you discover something fascinating? My passion for the planets, for example, has led me to memorize every detail about the solar system. It's not an obsession, as some say. It's pure love for knowledge. I've learned that we are all different, and that's what makes the world so interesting. Some of you are experts at reading facial expressions and social situations, while I am an expert at seeing patterns and solving complex problems. It's not better or worse, it's just different. And you know what the most beautiful thing is? When you find people who accept you just the way you are. My family, my true friends, my understanding teachers, they have learned to see the world through my eyes, and I have learned to navigate their world of social norms and indirect communication a little better. There are difficult days, of course. Days when the sounds are too loud, the lights too bright, and the world seems to be spinning too fast. But there are also magical days, where everything fits together perfectly, where my special abilities allow me to see and do extraordinary things. My message to you is simple. Don't see us as people who need to be fixed or cured. We are different, yes, but that difference is a gift. We are like a different color in the rainbow spectrum, necessary, beautiful, and unique. Every person with autism has their own talents, their own ways of shining. Some of us are good with numbers, others with music, others with art. The important thing is that we are given the space and support to develop these gifts. And finally, I want to share something I discovered. The world is much more beautiful when we accept and celebrate our differences. When we stop trying to fit into predetermined molds and allow ourselves to be authentic. So the next time you see someone like me, remember, we are not different in a negative sense. We are extraordinary, we are unique, we are a gift to the world. And maybe, just maybe, we can teach you to see life through different eyes, to find beauty in the details you often overlook. If this story has touched your heart, I invite you to share it. Together we can create a more understanding and accepting world.
If you like it, give it a like and subscribe. We'll continue to explain several points, from what autism is to the latest treatments and research.
What is autism? Autism, also known as autism spectrum disorder, ASD, is a developmental condition that affects the way a person communicates, relates to other people, and understands the world around her. It is not a disease. It is not cured because it is not something that is wrong. It is a different way of seeing and living the world. Every person with autism is unique, with their own abilities and challenges. Why is it called spectrum? Because autism can present itself in many ways. Some people may need a lot of help performing daily activities, while others may live very independently. There are people with autism who don't speak, and others who speak a lot. Some have great memories or special abilities, and others have difficulty learning. Types of autism. Previously, there were different types of autism, but today they are all grouped under the name autism spectrum disorder. Yet many people and professionals continue to use the following terms. 1. Classic autism. People with great difficulty communicating who may avoid eye contact or repeat actions, such as rocking or spinning objects. 2. Asperger's syndrome. People who speak and learn like everyone else, but have trouble understanding gestures, jokes, or social rules. They often have very intense interests in certain topics. 3. Childhood disintegrative disorder. Very rare. Children who develop normally, but then, between the ages of 2 and 4, lose skills such as language or coordination. 4. Pervasive developmental disorder not otherwise specified, PDD-NOS. When someone has some features of autism, but not all, what symptoms can a person with autism have? Signs may appear in the first few years of life. Some common examples include: do not look into the eyes, do not respond to the name, do not point out things to share interest, repeat the same words or phrases, doing the same movements over and over again, feeling uncomfortable with noises, lights, or certain fabrics, have very specific routines, and get upset if something changes. What causes autism? An exact cause is not known. Scientists believe there may be a combination of factors. Genetic. There may be inherited genes that increase the likelihood of having autism. Environmental. Some factors during pregnancy or childbirth could influence, such as infections or lack of oxygen. Brain development. The brains of people with autism function and connect differently. Important. Autism is not caused by vaccines, poor parenting, or lack of love. This has been confirmed by numerous studies. What other conditions can people with autism have? Sometimes autism is accompanied by other conditions, such as anxiety or depression, attention deficit hyperactivity disorder, ADHD, epilepsy, intellectual disability in some cases, sleep or eating problems, language disorders. Each case is different. Some people have several challenges, others very few. How is autism diagnosed? There is no blood test or X-ray that will show it. The diagnosis is made by psychologists, psychiatrists, or neurologists by observing the child or adult's behavior and asking questions to the family. It's best to diagnose early so you can start getting support from a young age. Are there treatments? Autism can't be cured, but there are ways to help people reach their full potential. The most common treatments include speech therapies to improve communication, occupational therapy to help with daily tasks such as dressing or writing, behavioral therapy such as ABA to teach new skills, psychotherapy to treat anxiety, emotions, etc. School support with integrative teachers or adapted plans. Each treatment must be personalized. What medical advances and research exist? Scientists are working hard to better understand autism. Some important advances include genetic studies to understand how genes influence, neuroimaging technology, such as brain MRIs that show differences in the autistic brain, artificial intelligence, which helps identify signs of autism faster, medications. These do not cure autism, but they can help with anxiety or sleep problems, inclusive education. There are increasingly more programs to integrate people with autism into mainstream schools. How can we support a person with autism? The most important thing is to accept and understand. Listen without judging. Respect their way of communicating. Next, don't force them to look you in the eye if they don't want to. Be patient with their routines or special needs. Value your talents. Fight against prejudice. Conclusion: autism is part of human diversity. It's not about fixing anyone, but about building a more understanding world where all people can live with dignity and joy. With information, respect, and love, we can make a big difference.
If you like it, give it a like and subscribe. Autism is part of human diversity. It's not about fixing anyone, but about building a more understanding world where all people can live with dignity and joy. With information, respect, and love, we can make a big difference. We continue with the psychological aspect, understanding it to better support others.
Living with a person with autism as a mother, father, teacher, sibling, or friend can be challenging, but also a learning experience. To achieve a good relationship, we must first change the way we understand the communication, emotions, and behavior of autistic people. Neurotypical versus neurodivergent. Two ways of seeing the world. Neurotypical people, i.e., those without autism or other neurodevelopmental conditions, often think, feel, and communicate in similar ways. People with autism, on the other hand, are neurodivergent. They process information, emotions, and social interactions differently, not inferiorly. This is not a defect. It is a neurological difference that requires bridging the gap, empathy, patience, and concrete strategies for effective communication. How to communicate with a person with autism. Here are some psychological and practical keys to achieving respectful and clear communication. 1. Direct and concrete language. Avoid metaphors, double entendres, awkward jokes, or irony. For example, did the mice get your tongue? Why are you quiet? Is something wrong? 2. Use visual aids. Many people with autism think better in pictures than words. You can use drawings, photos, or pictograms, lists with icons to explain routines, videos, or practical examples. 3. Respect their communication style. Some people don't speak, but communicate with gestures, electronic devices, or gazes. Don't force speech, but respect their natural way of expressing themselves. 4. Avoid unwanted physical contact. Some autistic people find touch invasive. Asking permission before touching is a form of basic respect. 5. Give them time to respond. They often process information more slowly. Waiting without pressure or repeating themselves helps a lot. How to raise a son or daughter with autism. 1. Unconditional love. It seems obvious, but it's not always easy. Sometimes a child with autism doesn't hug, say, "I love you," or look into your eyes. That doesn't mean they don't feel love. Show affection in a way they understand and accept. 2. Clear and predictable routines. Change can cause anxiety. Routines provide security. Use schedules, visual calendars, or songs to anticipate what's coming. 3. Focus on what they can do. Don't focus your education only on what they lack. Enhance their interests, talents, or unique ways of learning. For example, if they like to put things together, use that to teach math. 4. Calmly reinforce, not punish. Punishments often generate frustration or fear. Instead, reinforce achievements, even small ones. Correct firmly but without anger. Provide emotional support when they are overwhelmed. 5. Listen beyond the behavior. A tantrum isn't always a whim. It can be a way of expressing that something hurts, frustrates, or confuses them. Try to understand the reason before correcting them. Helpful psychological strategies for everyday life. Prepare outings or changes in routine in advance. Use social stories to explain situations like going to the dentist or playing with other children. Have a safe space at home where they can calm down if they become overwhelmed. Avoid very noisy or brightly lit environments, which can cause pain or sensory anxiety. Don't force the child to interact if they don't want to. Respecting their social time is key. Understanding their emotions. Autistic people do have deep emotions, but they may express them in ways that neurotypicals don't always understand. Some key points: they may not notice social cues, such as when someone is sad. They may appear detached, but feel a lot inside. Sometimes they can't put what they feel into words. This is called alexithymia. Crying, silence, or repeating phrases can be ways of expressing distress or joy. We shouldn't interpret what they feel from our logic, but rather ask, observe, and learn how they show emotions. How can we help them relate to others? Find inclusive spaces, schools, activities, or groups where there is understanding. Teach social skills clearly, with examples and practice, without pressure. Support interactions without forcing them. If they don't want to play with others, that's okay too. Reinforce when they say hello, wait for turns, ask for help, or share. Final message for parents and caregivers. Having a child with autism may be a different path than you expected, but it can also be a wonderful adventure filled with learning, tenderness, and wisdom. You are not alone. There are communities, support groups, therapists, and professionals who can help you. Don't blame yourself. Autism is no one's fault, and your love is the foundation of everything. Be flexible. Some days will be difficult, others will be magical. Every small step forward is a great achievement.
If you like it, give it a like and subscribe. Finally, we named some great autism scholars, their contributions, the latest research, and current
Major autism scholars and their contributions. 1. Leo Kanner, 1894 to 1981. Who was he? Austrian-American psychiatrist. Main contribution. In 1943, he was the first to describe autism as a distinct condition. He observed 11 children who displayed similar behavioral patterns, communication difficulties, rigid routines, etc. Significance. He took the first step in recognizing autism as a diagnosis and not as a form of childhood schizophrenia. 2. Hans Asperger, 1906 to 1980. Who was he? Austrian pediatrician. Main contribution. In 1944, he described what we now know as Asperger syndrome. He studied children with special interests, advanced language, and social difficulties. Importance. Although little recognized for years, his observations gave rise to a specific category within the autism spectrum. 3. Lorna Wing, 1928-2014. Who was she? British psychiatrist and mother of a daughter with autism. Main contribution, popularized the term autism spectrum and helped unite different forms of autism under a single category. Importance, changed the way autism is understood, showing that there is not just one type, but rather a variety of forms. 4. Simon Baron-Cohen. Who is he? British psychologist and neuroscientist, director of the Autism Research Center at the University of Cambridge. Current contributions. Investigates theory of mind, the ability to understand what others are thinking or feeling, something that may be impaired in autism. Developed the concept of the extremely masculine brain to explain certain traits of autism, controversial but influential. Explores the relationship between autism and empathy. Significance. She has helped us understand how autistic people think from a psychological and neurological perspective. 5. Temple Grandin. Who is she? Professor at Colorado State University, designer of livestock management systems, and advocate for the rights of autistic people. Current contributions. She herself has autism and has written books that help others understand visual, sensory, and emotional thinking in autism. Speaks from experience, how the sensory environment affects how a person with autism can educate and work. Recommended books. Thinking in Pictures. The Autistic Brain. Significance. She has debunked myths, showing that autistic people can lead full, successful lives and contribute to the world in unique ways. 6. Tony Attwood. Who is he? Australian psychologist specializing in Asperger's syndrome. Current contributions. She has written practical guides and books for parents, teachers, and therapists. She studies how to improve the self-esteem, anxiety, and emotional life of people with autism. Significance. A world leader in the education and emotional understanding of autism in adolescents and adults. 7. Uta Frith. Who is she? German-British neuropsychologist. Current contributions. She studies how the autistic brain works in relation to language, reading, and reasoning. She has worked with Simon Baron-Cohen on theory of mind and social development. Significance. She has contributed neuroscientific data to understanding how autistic people process the world. Current research and advances in the study of autism. Functional neuroimaging. Using magnetic resonance imaging, fMRI, scientists can see how the autistic brain works. Different patterns of neuronal connections are being identified. Genetics. Hundreds of genes are being discovered that could be related to autism. There is no one gene for autism, but there are combinations that increase the risk. Technology and autism. artificial intelligence applications and programs are being developed to aid in early diagnosis, virtual reality to train social skills, educational robots that help practice pressure-free interactions, person-centered approaches. Current science is moving away from the focus on correcting autism. Today, research is being conducted on how to adapt the environment, improve quality of life, reduce anxiety, and foster autonomy. Conclusion: autism is not a disease, nor a mistake, nor a tragedy. It is a different way of being in the world. Understanding autism is a process that requires opening the mind, but above all, the heart. It is not about curing or fixing those who are different, but about learning to live with, respect, and value their unique ways of thinking, feeling, and communicating. Throughout this work, we have seen that the autism spectrum is very broad, that each person is different, and that there is no single type of autism. We also understood the importance of clear communication, respect, or through routines and non-judgmental support, especially when it comes to raising or living with an autistic child or adult. Science has advanced greatly, from the early studies of Kanner and Asperger to current research that shows us a more humane and person-centered approach. Today we know that autism is not a limitation to a full life, but rather a shared challenge between the autistic person, their environment, and a society that must become more inclusive. Accepting, respecting, and supporting with empathy transforms not only the lives of autistic people, but also the lives of those privileged to walk alongside them.
If you like it, give it a like and subscribe.
Final message. A call to unconditional love. May we never lack the courage to love what is different. May we never lack the humility to learn from those who think, feel, and dream differently. Autism doesn't need pity, it needs bridges. Bridges of patience, tenderness, time, and truth. Every person on the spectrum is a universe to be discovered, and whoever dares to look with the eyes of their soul will find they're not an enigma, but a light. A different light, one that doesn't scream, but illuminates everything it touches. Educating, accompanying, and living together with love is not a sacrifice. It is an opportunity to grow, to open up, to change the world from the depths, because true inclusion doesn't begin with laws or diagnoses. It begins in each person's heart. And if you, watching this video, decide today to look at others with respect, then you are already making history.
If you like content on this channel, please like and subscribe. You'll help us create more videos.